All right, welcome, ladies and gentlemen. Welcome to Dr. B Stress Free, real talk for you. And we're just excited. This is a podcast, something I've been saying I was going to do for a long time. And I'm just elated to be able to share and care. And we're going to be talking about health. We're going to talk about wealth. We're going to talk about politics. Y'all know it's a lot of politics going on out there. You know, I ran for state rep last year, and I don't want to get into all that right now, but you guys know I did it in Michigan, never had done it before in my life. I think I got 22,000 votes, and my other guy, he got 23,000. Somebody told me I should do a recount. I said, no, I'm not going to do that. But it was exciting, and I learned a lot. But I do feel that in today's society right now, mental health is so key. And unfortunately, from a medical perspective, from even people wanting to get help, they're having problems, as far as insurance paying for some of the things that are needed. I know people that are looking for 30-day rehabs and can't find them because of Medicare. And I'm just telling you guys, I know this for a fact because I've been helping them. What do we do? Then we want to say, oh, this just happened, and we don't know why. A lot of people are running around and they need help. And it's okay to not be okay. And so I just want this podcast to be where all people that I know come together, professionals, where we can share and care, and we can just do some great things. So what I would like to do, at this point is I have a young lady who I've known for quite some years. We have traveled the world together. And she is from New Orleans. I hope I said it right. New Orleans. And her name is Theo Cameron Mitchell. And Theo is a seasoned marketing pro with a passion for candles and gardening. And she is educated in Long Beach, California. She is just into entrepreneurship. She says, Dr. Pat, I got to do something to just create a space for myself. And, if you're not comfortable in your space, that's a problem, right? So this young lady, I don't want to steal her thunder because she's just awesome. And I mean, she never ceases to amaze me. And so she's excited about her new venture, as well as she's in the mental health space, and she does a lot in the communities. So without further ado, Theo, how are you?
Thank you, Dr. Pat, for that great introduction. And I just wanted to say thank you for all the beautiful people that tuned in and, everyone that have worked in the capacity that they're working in. I appreciate you and thank you for your service, you, Dr. Pat, and all the other doctors and doctors and teachers that we have online. But when Dr. Pat and I met, we talked a little bit about the venture that I'm in now, because Dr. Pat and I have traveled the world together, and we were or still are in the travel club together in one capacity or another. She's like my mom on the road. She gives me advice on how to travel. So because I was always afraid of traveling, I was always afraid of catching flights, and she helped me to mature in that area, and I want to say thank you for that. But I really thought that we were going to be I was going to be introducing my product, but with you saying stress-free, Dr. Pet stress-free, I decided to come up with a product that, for me, I'm a person that loves candles. I'm a very bad asthmatic. Dr. Pat has some concerns too about her respiratory. So I came up with something. I have my own line of candles, and they're called Soulful Serenity. But also, before I say all that, I want to say that I've been a mental health professional working in the capacity of one form or another for 25 years. And anybody know that working with mental health, teaching kids, being in the military, whatever capacity you're in, stress will develop in your life. So I always try to create a peaceful space in my life because my partner, we've been married since 2015. She's retired military. She did 21 years. So she is my peace. But that's not all I need. I need more than that. So I created this line called Sorry for Serenity. And as you can see, it has.
Oh, that's beautiful.
It has my logo is, because I love yoga. I just did chair yoga the other day. Y'all got to try that too. I'm sorry, not chair yoga, wall yoga. where you do not so many positions on the floor, but you're more or less working on your back and your feet are on the wall. So anyway, try that. It's not bad. It's not as strenuous as the other one, but I came up with a line called Soy for Serenity. And the reason why I chose that word soy is because the candle is made of soy and it's derived from the soy plant. So I create my space every day. As you can see, I have one burning now. Everyone knows me. I used to be an advocate for Bath and Body, loved their candles, wasn't educated on them because they use preference wax, like the wax we use on our hands and our feet. They use that wax to make their candles. So I made some bullets because I didn't want to forget anything. But my candles are derived from the soy plant, as opposed to this is just derived from like petrol. I'm not a chemist, but I don't know everything, but I've done my homework. So these candles burn they burn 30 to 50% longer than a peppermint wax. They're vegan, and also anybody know me, they know I've been vegan. I've been pescatarian for many years. So anything that's vegan, I'm all for it. It's great on the respiratory system. It doesn't give off the fumes like the other candle from the other people. We're not gonna say their name again. But it's just healthier on your lungs. But I wanted to create a line. I also have my tablet. This is my site. It's called Soulful Serenity. I have all soulfulserenity.com. I only have 6 cents, and I want to also keep it at a limit because I just feel like when people have so many decisions to make, it's difficult. But anyway, so that's enough about my site. But I want to talk about mental health in the process. We all live with mental health. If you're living and breathing, you have mental health. Whether it's good mental health, fair mental health, bad mental health, we all have mental health, and we all have to create a space where we do something stress-free. And as Dr. Pat mentioned earlier, I like gardening. Gardening is stress-free for me. I just for also self-closure, July 11, I'll have 30 years clean from drugs and alcohol. So I have to create spaces that are safe. Thank you so much. Thank you so much.
That is
So
awesome.
I have to create, thank you so much. I have to create spaces for me. And I also help other people's lives. I work with women that are fighting domestic violence. I work with women that are pregnant and are trying to stay clean from drugs and alcohol. And as you know, Louisiana is a place that never closes. So alcohol is always, thank you so much, Ms. Kavara. Louisiana is a not sleep city. It's like Las Vegas or New York. So, I have to create things that keep me safe and that keep me in that serenity space. So that's why I came up with those names, Soyful, so that you don't forget that they're made of soy, and Serenity, because we need serenity in our lives. So it's so many things going on in life. I also invited my colleague here, KC, because I think she is one of the best case managers that I've worked with over my 25 years. And I invited her in to speak with us in this space and maybe talk a little bit about the stigmas and all the stuff that she goes through. I'm not a social worker. I don't have the LPCWXYZ behind my name like she does, but she does. And she's going to tell you about what she does on a day-to-day basis to keep us safe and to keep our members safe. Because we both work for Humana right now. And that's what we do. We keep our members, we help them. So we don't sell insurance. They choose our insurance. We teach them how to live and how to get to their next level. So that's what we do on a daily basis.
Okay, I got a question. So
Gotta answer.
What is it that I know you do. So what is it that you do to help a person on, that's just out there and they need help? What are some of the few steps that you take on that?
Well, first of all, we give them the resources.
Okay.
First, we see it's called stages of change, and KC could chime in on that if she likes. I don't know if you want to introduce KC or how you want to do it.
We can introduce KC, or if you want to introduce her, you go ahead and introduce her, because KC, you guys are partners, so you guys are working together. Yep. So go ahead and introduce her.
KC is my buddy, y'all. Like, we just jammed. We met last year through Humana. We work from home. We call each other our work wives. So we're work wives. and we vibe. Like, she has the credentialing, I don't have the credentialing, so I have to kind of bounce off of her. So she will get a member if a person needs help with, if they're homeless, or if
Uh-huh.
a person needs help with resources. That's what she and I do. But
Oh,
KC is more of a social worker. She's a therapist. Am I right?
Yep, a therapist. Yeah, I'm a licensed professional counselor. Yeah,
wow.
but
Let it roll. Let's go. Let it roll.
I know all the things. But as Theo was saying too, like Theo is, and she knows this. Theo is also my grounding, especially at work, because when on the days that I'm like, "Wolf, this is wild," and Theo may not have the quote credentialing, but she has the knowledge because
Oh,
after all the years in the field, she understands, and she has seen it all. There's a piece of mental health is the ACT team, and you are really in the field and in people's homes and in their spaces. And Theo has done that and really knows mental health. So she can say she doesn't have the credentialing, but she's got the knowledge.
hey, listen, I already
Um,
was going to say that, but I'm glad you're saying it instead of me saying it because you and her work together. But that's just how Theo is. You know what I'm saying? She's very, very humble, but I already know she's in the trenches, don't mind doing the work. And so, yes, so this is exciting. So I'm gonna let you guys keep talking because I love
yeah,
how you guys are vibing.
it is so great. I can, and I can't tell you how much I appreciate it, because if I'm experiencing something, I can run it by Theo and be like, Theo, what's going on here? And between the two of us, I think there, and Theo is also very grounded, whereas I'm very person centered. I like to meet a person where they are. I can go off on tangents. Sometimes I get in trouble for like talking to people. If I'm out with folks and I'll talk to people, I can go off on tangents. But Theo's like, let's talk about our goals. Let's talk about where we're going. And it's so fantastic and very helpful to me. And she keeps me straight. She keeps me like moving forward and everything. And I cannot say enough how much I love it. I also can speak, since we're talking about the candles, to her candles. I am not a Bath and Body Works person. Excuse me for saying it. The smells
It's
are too
okay,
heavy
you're
for
fine.
me.
I mean, you're fine.
The smells are too heavy for me, but I will say I got one of Theo's candles, and it's like the exact right amount of scent, and it's just they're fresh and really lovely. So I can
I,
also say that, but which I think is helpful in the space because, as you're saying, that stress-free part, working in insurance and working in the field, it is a lot of stress throughout the day, and you need a space to unwind, and you need a partner, like a good partner to like come back to and be like, hey, what's going on? And Theo's fantastic for that. I know Theo's partner is also good. Like it's just having that space and having that energy is amazing. And like having somebody who can also pump you up, because I think we've all experienced, and I love hearing that there are so many teachers on the call, because I'm also like, I know teachers, it's nonstop expectations on you from everyone, from the students, from the parents, from the administration. And it's hard. And you are also trying to create that space that is special and safe for students. Um, and then coming in and like making sure you have that space for yourself. So I'm excited to hear that there are so many teachers on this call too. I cannot say enough good things about teachers, especially in New Orleans. There's a lot going on here that we need some good teachers.
well, and there's a lot going on. We have teachers from Florida on here, from Detroit on here, and one of our previous podcasts, we were talking about the system and is it failing us, and of course the parents and just all the things that are going on. And the teachers is where the rubber meets the ground, where the rubber
Yeah.
meets the road, right? And
Yeah.
so everybody is grasping and everybody's looking for some kind of way to be able to help other people. And that's where we are. And that's why I came up with this space. I had to name Dr. V Stress Free because I did research on identifying the stressors and coping strategies of women in leadership within corporate America, education, and government. And by me working 34 years with the Department of Army, working with primarily all men, and a lot of times being, even not only minority, I understood that there's extra additional stressors that we face and have to deal with. So that's what I did my research on. And so the stress part is where that has come from. And my son told me when he goes, Mom, you graduated. I got my doctorate over 10, it's been about 15 years ago, and had not really done anything with my research. And so this is an opportunity to give back to our communities, bring in our professionals, because our professionals need to be trained too, right? And it's okay not to be okay. And that's leading into the stigma, especially within, I want to say in the Black community, but in all communities, but more so even in the Black community, this stigma of just being able to have a counselor or going to see a psychiatrist or what have you. We're not there yet. And we have to let everyone know that a therapist needs a therapist, right? Would you agree?
Absolutely. Yeah. And I think too, I'm going to even take it a step further from it's okay to not be okay. It's actually healthy to not be okay, especially in the times that we're living in, because these are such strange times. And and I can speak for my parents' generation where it's expected. There's this level of you're just supposed to like grin and bear it. And I do feel that it's true, like especially Black women are really expected to be strong and just like take care of families and like do the extra. I cannot tell you how many times I worked in the school systems here, and I cannot tell you how many times it was the mothers and the grandmothers who were really holding everything together, making sure things were running, and really trying to make sure their families were cared for. And they were just getting so much opposition from work, from, the general community, from society. So I do feel like there's that extra bit of stress, but there's also that message that you are supposed to be strong and independent and take care of everything for everybody else, and you come last. And I think that is such a, it's so hard, and it becomes internalized, and then it's fighting, and then you end up like fighting yourself. It's like shadow boxing yourself, that you have to like come from a place and really accept that, like, no, you shouldn't just be okay. Like, things should be different and things should be better. Like you can ask for help, and it doesn't have to necessarily be a therapist, but like if you have a pastor that is open to listening to you, if you've got a friend who can also maintain boundaries, because boundaries are also a big piece of like how you like hold it together, really, because I think it's really hard to come up to have boundaries and to have safe boundaries. And I think Theo's also great at that, and has been really great in our partnership too. Theo is great at setting boundaries and holding those boundaries, and reminding me too, because as I tell people, I'm like, I have to practice what I also tell people in therapy. Like,
Practice what you
you
preach,
do
right?
have to hold those boundaries. Yeah, exactly. Like, it's got to come back to me. Yeah.
Just to piggyback what you're saying, KC, like boundary setting, I think it's important because a lot of times when individuals are in situations, they have not been set, boundaries have not been set. So to get the party started, let's say this is where we're at. This is what you have to do. And I also, not just on my job, but even people that I mentor in the community, I try to tell them, your peace is your peace. Like, you can't go to Walmart and say, give me a gallon of milk and a bottle of peace. Like, you have to create your own peace.
Right.
You have to, and if you allow others into that area, that boundary area, if you allow them in, they're going to mess up your peace. So boundaries is very important. Like, you don't get to come right here unless I open the door and allow you in. Because people will rob you of everything that you have. And peace is definitely one of it. It's not so much the people, it's the devil. So whatever you believe in, I believe in as a God, and I believe in as a devil. So for me, I believe that the devil will try to do everything he can to make your life chaotic. So it may be trivial, but for me, when I burn these, my partner will tell you, and even if you don't get my candles, it's okay. But she'll tell you, I wake up in the morning, I create that ambiance for myself where this is just peaceful for me. And even if I'm not burning a candle, I put my phone on do not disturb, little things like that at night. Like the only people that can call me are my mom or whoever. So you have to create boundaries for yourself, whether it's workplace, whether it's with your kids. You know what I'm saying? I tell my son no. Sometimes it hurts, but I tell him no. So
It
I
doesn't
think
hurt,
boundaries.
Theo.
Yeah, it does. It does. Because I want to say, yes, you deserve the world, but you also have to learn that there are going to be some no's in life as well. But yeah, like creating your peace and making it stress free, your life stress free is important. You know, we work with individuals also that are dual diagnosed. They may have a
Mhm,
mental health issue also, and they'll also be on drugs. So,
mhm.
and a lot of times, what I've learned in my life working with mental health is that they don't really want to do drugs. They just want to stop the voices in their head, or they want to stop the depressive feelings that they have. So why not zone out? You know what I'm saying? Earth people, we call them earth people when you're in recovery. Earth people that can drink and do stuff like that, y'all can drink a glass of wine. I can't drink a glass of wine. You know what I'm saying? So, you know, it's just, I don't know. I'm rambling right now, but
No, you're not. You're doing great.
I
Listen,
love it.
it's
everybody's
just
listening.
it's just really, really, really important when I teach, because I think our jobs are so important. School teachers, all that, and people
Yes.
that are in the military, we hold people's lives in our hands, and
Yeah.
that's heavy. That's heavy. That's
Yes.
really, really
Mhm.
heavy. Even if you're a kindergarten teacher, the young lady who I mentor, Maya, she calls me her mom, and I call her my daughter. But I listen to her every day. She has kindergarten kids that won't listen to her, you
Mm.
know, or they're cussing her out. First grade and kindergarten, like first grade, I think she teaches first grade, and they're cussing her out. So I have to sit down and listen to her and give her the optimistic thing to say, but I don't know what to say because I don't have that experience. I know when I was in first grade, I had to listen, or when I got home, my mama was going to tear me up.
Right.
They're not, this generation is not like that, you
So,
know, so.
so what is a suggestion for that? Because again, we've got a lot of educators on here, and I've heard a lot of stories, and mine know if I looked at them a certain way, they knew they had to be quiet. So, but this is a whole nother generation, and you've got
It's a
babies
whole,
raising babies. And so what is some of your, and I know you guys again, boots on the ground, you're working with people that and see, Theo, you have that spirit. You're authentic. You know how to deal with people. You know how to set those boundaries where they're like, oh, I can't mess with her because she already took that. So they're going to go with the nice one. No, I mean, I get it. But see that when you have those instincts, they're natural instincts. Everybody don't have those instincts. And a lot of it's spiritual. I can be in a room and I can size people up real quick. All I gotta do is talk to them for a few minutes and I got it. But that's a natural born instinct. I didn't know it for a long time. Now, as we grow older, we respect our thoughts, we respect our instincts, and yet we still want to question them at times, and you want to sit back and say, well, let me watch this play, let me let this rewind, let me let this play over again, and after it keeps playing, you know what you see, you know what you saw, and you know what you just heard. Does that make sense?
Yeah.
it
But I
does.
think that's it. It's a big piece of it too, is trusting those instincts. And then I love the word that you said too, is being authentic, because I think when you're authentic, it's easier to come up with those boundaries because, if you're guilty, if I'm with somebody, I'm like, I need to make this person like me, my boundaries go down. Like I'm not being true to myself. I'm not being authentic. And it's true also when you're talking with people, because I'm not gonna lie, I don't love the insurance structure that we live in. I might have froze. But and I'll tell people that, and I'm honest. I'm like, but this is also, but I'm like, this is the structure we're working in. Like, how do we make this work for you? And being your true self, I think, and being that authentic self is such a key piece of boundaries and such a key piece of mental health. And sometimes it's really hard to get to learn who you are because you might not even be authentic with yourself. And that's going to happen for all of us at some point in our lives. That's just the
Yeah,
reality of it. I
yeah,
think, Theo, as you were saying too, like folks who are using substances can't access their authentic self. So they're trying
yeah.
to get to something that feels better than the kind of
Mhm.
false self that they're living in oftentimes. Theo, you might be able to speak more to that too.
I don't know. I've always been authentically me. I get a lot of backlash from people stating that I don't have filter, but I don't know. I keep myself safe like that. You know, I just say I always tell my little mentor daughter, I always say what everybody else thinks. That's all. I mean, I don't know.
Right. KC.
But as it relates to mentoring people and guiding people, you know, you have to create boundaries, especially when you're dealing with a certain type of population. If you don't create the boundary, then they know that there's fear, or they know that, oh, she don't have it all together. And then they're gonna do what they can to try you. Let me see if I could get this extra pencil, you know, because I know she's not gonna control it. She's just gonna let me get it. So, you know, I just think you have, again, it goes back to creating a boundary. You know, you have to create that boundary. And it takes work. Some people, like you say, don't have it from the beginning, but it takes work. It took work to get where I'm at, because I used to be really shy. I'm an introvert. But what I learned through therapy is that I'm an extroverted introvert. So I come out and then I like going back in. I could be home by myself like forever.
Go back to safety, huh?
Yeah.
You know, Casey, you said something though that I want to go back to, and it makes a whole lot of sense when you start thinking about people that are abusing drugs, alcohol, whatever it might be. They don't know how to get in touch with their authentic self. And so they have to become someone else. And then when they realize that that other person that they become might not be a good person, and they withdraw back. You know what I mean? And it's a struggle. It's a struggle, like you said, within the person. And what do you recommend for a person going through that?
For a lot of that, it feels.
Can I just say something before you say that, Casey? What I learned through therapy, and also what I learned through counseling individuals and also in recovery, they teach us that whenever a person starts using drugs, that's where their life stops. So if you have someone that started using drugs at 21 and they're now 49, they may have the body of a 49-year-old, but their maturity growth is stopped when they started at 21. Have you heard that before, Casey? So when you're in recovery and a person is trying to get to that, if they're trying to recover and get better, they got to do the work. I mean, there's no magic pill, or there's no magic therapist that can say, okay, this is where you should be, now get there. Because if you started using, the only thing that you are drinking, the only thing that you can do is your mind is only on about how much you can get or how much you can use. Your mind is not on, oh, I should be, you know, I don't know, wearing a certain type of bra, and I don't know, I'm just saying that. But, you know, you don't think about stuff like that, because the only thing you're consumed with is how do you stay high, or how do you stay intoxicated. Go ahead, Casey.
How to disconnect. I think as you were talking, I think too, there's a form of therapy, dialectical behavior therapy. It was created for borderline personality disorder specifically. And borderline personality disorder is, you know, we in the world live in gray spaces. There's not like necessarily black and white, but borderline personality disorder is very black and white thinking, and it goes from extremes. So dialectical behavioral therapy kind of comes to, and I'm not gonna lie, I don't practice. My background's actually more in play therapy and kind of person-centered therapy, but I feel like this is also such a huge piece of all therapies. And the concept is you have kind of three different minds. You've got your emotional mind, your rational mind, and those are kind of two separate spaces. And then the goal is to come to wise mind, which is kind of a combination of the rational mind and that emotional mind, because that emotional mind is very reactive. The other way I've heard this described, and I really like it.
Come on, Dr. Casey. You are educating the people today.
Yes, she is.
This is my favorite.
Emotional, rational, and then the wise mind. I'm listening. Keep talking.
Yeah. The other way I've heard this described, and I kind of like it this way too, is your brain is shaped. This is, roughly this is your brain, and you've got the back part of your brain, which is the first part to be formed.
Mhm.
That is kind of known as crocodile brain, or as we say, that reptilian brain. In Louisiana, it's alligator brain, but it's that reptilian brain. And reptiles are, you don't think of a lot of like rational thought with that reptilian brain. They're going to snap at you. They're out there looking for food. They're looking for sleep. They're just getting their needs met. So that's that part of your brain. Then in the back part, the next part to form is what they call the puppy dog brain. That's that emotional mind, and it gets excited. But when it gets too excited, it makes a mess in the house, and can't and is biting and nipping, and you really have a hard time controlling it, managing it. Then you get into the, prefrontal cortex, and then you've got your computer brain, which is the most recent part to develop. And that is, kind of like critical thinking. They're all connected. Again, we're closed around the thumb, and the thumb is essentially the amygdala. They're all connected to the amygdala. And the only part that can really control that is breathing. And I'm saying this because if I am hyped up and I'm trying to practice breathing, not always easy to get to, but they're all connected to breathing. And I think one of the things that comes up when we're kind of like going through all these different parts of our brain, part of the getting to wise mind is remembering to breathe. And I actually learned this from a voice coach, not for me personally, but from a voice coach who told me that one of the biggest pieces of advice he would give to his clients was to exhale, because a lot of times we will hold our breath and we, scrunch your shoulders, and you have to remember to let it go too. And you can feel when you're getting stressed and when you're getting worked up and you're holding more and more in, it's important to let it go.
Release.
And another piece of that, back to the DBT, that dialectical behavior therapy, is, and I love this image, and so I'll gift it to you all. It's think about riding a wave, because if you're ever at a beach anywhere, the waves are going to come in, and it might be one of those really big waves. It's going to crest, but it's going to crash. Whatever you are going through, no matter it, might be one of those 20-foot waves, might be huge, but whatever emotion that is, stay with it and let it subside, because it's going to go away. Like that big part is going to go away. And a big piece, I think, too, like Theo's saying, you have to do the work. The work is not easy. It's never easy. I would love to tell you that it's always been easy for me, but it's not. It's, and I'm still doing the work. You always have to do the work. But it's sitting with those emotions and like not trying to check out from them. Because one of our favorite ways that we do it in this world is we kind of like get onto our phones or like get in. And it's totally fine to do that sometimes. Sometimes you need to like check out and dissociate, but you also really got to stick with that feeling and really like experience it in whatever way you can. And a big thing that helps too is just even labeling the emotions, even if you're just like, I am really overwhelmed right now. And if you can, just saying it to yourself can help. Saying it to a partner that you trust can help. But just labeling it and admitting it, it can be that kind of exhale, that release where you're like, okay, like, there we go. We got this. Because I think that's also just one.
I think that's good too.
Mm-hmm.
I think that's great when you said labeling the emotion, because a lot of times when you ask a person how are you feeling, they'd be like, I'm all right. That's not all right. It's not on a feeling chart. So I need happy, glad, mad, sad, hurt. I need one of those. Happy, glad, mad, sad, hurt. So okay is not a feeling. I need you to dig deep in. And sometimes people might say, I'm mad. But in actuality, once you start talking to them, they're not really mad. They're really sad. But they're just saying that they're mad. Like, you hurt me. You made me mad. But when when I come down, you really hurt me. Like you really, really hurt me. But it's safe for people people to say, I'm mad. I'm mad. You pissed me off. But
Right.
in actuality, you hurt me.
Right.
That's the feeling that's deep down. So a lot of times people have to get in touch with what they're feeling, you know. So I don't know. This is just a great conversation for me. Like it was deeper than it was deeper than I want to know if anybody has questions for us. Like I know you said put it in the chat, but I don't want to just talk.
No, no,
We
no,
have a
we can do that. I was just, sometimes just
yeah.
vibe and I also think they could put in chat, but if someone wants to unmute, you can do that and ask your question. This is how we roll on this. This is how we roll. No, seriously,
And if anybody has
Right.
personal questions for me and my journey, I'm an open book. Anybody will tell you I have sat on a panel at Dillon University and spoke to students that were embarking on being social workers and things like that. So I've had to ask a lot of questions, answer a lot of questions as it relates to my journey.
Any comments, questions? Or go, you ready to say something, Casey?
Well, I was going to tell. Well, people. I mean, anyone jump in and ask. I was just thinking too. There's a nice graphic that, as Theo's talking about it, they call it the anger iceberg. Because I was like, oh, I feel so seen because I do when I'm hurt, I get angry. I'm a Sagittarius. I like a little astrology, so I get a little fiery, y'all. But there's an anger iceberg, and you can see. The top part is the tip of the iceberg, which is the anger. But if you look underneath, like an iceberg, there's so much more, and it's so much deeper, and it's all of those like sad, embarrassed. Maybe you have a need that's not getting met, unheard. I hate not being heard. That is probably my biggest trigger. But so like you can look at that too and kind of just see. And sometimes that might be what you need to do is like look and be like, I'm in my feelings right now and see what's going on beneath the surface in any way you can.
Wow.
And also even to touch on the students, like the younger kids that our teachers are teaching, sometimes they live with have mental health challenges, autisms and things like that. Sometimes we work with kids, but not that much. But kids do have sometimes struggle with mental health.
Right. Absolutely.
Yeah.
Any questions? Anybody got any comments? We have experts on here, so ask your question or comments.
I will also, while y'all are, again, please interrupt me. Doesn't bother me. I want to give you some tips if you decide that, and this goes for therapists, but also goes for any provider. You are your expert. You know yourself better than anyone else does. If a therapist isn't working for you, if it doesn't feel like it's a good fit, you're allowed to find another therapist. You're allowed to break up with the therapist. In an ideal world, you would at least message the therapist and be like, hey, I'm going a different direction. But also, we understand if that's not a thing for you. And it's the same with any of your physical health. Like, you know yourself better than anyone else does. And if anyone makes you feel uncomfortable, I'm going to say this, at some point in therapy, you probably should feel uncomfortable, but like, you got to listen to that, got to listen to that instinct and that gut feeling to make sure that you feel like it's a safe space for you to be heard. And that's true for primary care physicians. That's true for any doctor, any provider that you have. It's their job to listen to you. That is the most important thing. And I think that's something that we lose sight of kind of in the world that we live in currently is we're looking for fast answers. We're looking for quick fixes. And a lot of times diagnoses are more complicated than just one diagnosis or just, like there's more going on because we're all human with so many different pieces and the pieces are all moving parts. We're not living in a vacuum. We are like living day to day with new experiences. So always remember that when you're looking for a provider of any kind.
So I got a question for you. So if someone wants a therapist or they don't, because again, I still think there's a stigma behind looking for a therapist, but how would they go about looking for a therapist, and no matter what state they're in, whether in Michigan or, well, no, we have people in here from Michigan or Florida, DC area, Louisiana, you know, what's the first step?
There are, I think the easiest tool is Psychology Today, and I can type that in the chat too. It's probably psychology. Let me make sure I'm spelling it correctly.
You know what you're saying.
And you can just Google, yeah. But Psychology Today, there's so many different, that's honestly where I normally would go to look for a therapist. A lot of therapists will advertise via Psychology Today. Facebook is actually a really good resource. Check with your insurance. If you've got insurance, check with your insurance company. That's a good resource.
And Medicaid is pretty good with you know, what do you have? Well, I'm not sure about Medicaid, KC. I'm not sure if you know, but Medicaid is really good with offering resources because they don't want us to be in the hospital as Medicaid recipients. They actually want us not in the hospital. We call them frequent flyers with Humana. We try to prevent that. So they actually try to get you the treatment and the help that you need.
Yeah, and I think, and I truly, I think any insurance company, like any level, any area of insurance too, you can call member services. Medicare and Medicaid definitely both offer. They usually will offer like case management to get you connected to services. And so that is a really good resource.
And also you know, you may know someone that may have a crisis, and you could dial 988, and that's from any state. That'll help if the person is suicidal or just needs someone to talk to. They can dial into 988.
And they'll connect you to resources too after that conversation. There are also like a lot of, usually like a community health agency, they're going to have a lot of resources and can get you connected. If you've got a primary care doctor that you trust, they'll get you connected to somebody. The biggest thing is just being okay with asking. And if the most you feel comfortable with is typing a search in Google, then type a search in Google or whatever search engine you prefer. And because there are resources out there for everyone. So it's great to just ask and see what's available in your community.
Right. Well, thank you very much. So I'm going to pick on some people now since nobody's speaking up. I don't know. This is the first time I've had several podcasts. We're just getting started, but I always get questions. But I think they're just all soaking it in. They're just so amazed at what you guys are talking about and your expertise and that. So Miss Barbara, do you have any questions about anything? She's a Detroit retired school teacher, and she shared some stories with me. Miss Barbara, you have any comments about anything?
No, but I do have a statement. And in regards to mental health, we know that it's emotional and it makes us act a certain way, and we handle stress a certain way, and our social well-being is at stake. But nowadays, this generation, they lack skills in dealing with stress. They have no coping skills. And they actually tend to, they have the sense of belonging, so they join gangs, and they do just erratic type things, or they do behaviors that are not considered normal. And it's like, I'm in the situation now where I feel that spiritually, if we give them a sense of spiritual being, and it would help them kind of understand. And it's how do we make them, or how do we make therapists or going to psychologists or psychiatrists? How do we make that fashionable? Because that's what it's going to take. Oh, I have a therapist. How do we make that fashionable? It has to be across the board type thing. And because most of it is due to fear.
I think one of the biggest things, because what I'm hearing too is needing, and I think it's true for most, well, it's true for everyone, but one of the biggest things that kids need and adults is we need a sense of belonging.
Mhm.
And I think part of making therapy fashionable or okay or acceptable is also modeling it. Because my sister asked me to, and she's my sister. My job as a therapist, and she asked me. She said, if I go to therapy, does that mean that something is wrong with me? And I said, absolutely not. The thing is with therapy, it's actually really more about, especially for most people, most therapy is about really validating you as a person. And I think that some of it is making sure that people understand that they're still accepted, that they're still loved if they go to therapy, and also being there while they kind of change, because there will also be changes, and it will disrupt the balance of their lives and disrupt the balance of relationships too, which is also something that we in the larger community also need to be prepared for, because that's a change too that we have to be aware of. And I'm just, as you're saying it too, I'm like, I would love it if therapy made it more into like popular music,
Right.
just
Like a rap or something about,
yeah, like if we could get some rappers like rapping about therapy. I'm like,
right,
I know.
hey, my
kids.
therapist is better than your therapist. You know what I mean? I mean, because what Barbara's saying makes sense. We have to make it
And
popular.
you know what? And I'm sorry.
Oh no, go ahead, Theo.
It's a delay in it. It's a delay.
No,
I'm
you're
sorry.
good. You're good. Go
But
ahead.
speaking on you saying about making it popular or making it like attractive to them, because that's what it's all about. They like attraction.
Mhm.
So I think a lot of the what is this guy that comes on the radio? He talks about mental health a lot. Charlemagne the guy, like he's
Yeah.
he's popular. So, he talks about his own mental health. And I think just having more open conversations about it. And for me, when I'm counseling an individual, I let them know, just like I got on the call and said, I'm in recovery of 30 years if I make it to July 11th. But I always give self-disclosure. Like at one time I did commit suicide. I tried to commit suicide. I went, but I didn't really want to kill myself, but I needed that. I had that yearning that I wanted to feel better, and I wasn't feeling better. So did I want to leave? No, but I wanted something else done about it, and I just didn't know what to do. So a lot of times for me, when I practice day-to-day conversations with individuals over the phone that don't know me from Adam, I tell them, look, I know it's difficult talking on a recorded line. Don't worry about that. If they listen and they want to hear this recording, let them listen. We're trying to save your life. But a lot of times I'll tell them, look, I was in a mental health hospital as well. You know what I'm saying? I did it. Like, a lot of times, and I'm saying a lot of times self-disclosure. I think everybody, all 17 people that are on this call have had at one time or another felt as though they were lost or felt as though they were depressed or sad.
Yes.
That's a part of your mental health. So I think talking to kids and talking to young people and letting them know, I did it. Like, don't look at me thinking I'm holier than thou, because I'm not. I
Right.
did everything that you probably think about doing. So if you want to talk about it, let's have a conversation about it. But not letting them know that, yes, I'm a retired school teacher, but I've been through some things in my life, and not keeping it, not so much being a wide open book if you don't want to, but let them know, hey, I've been there too. I experienced the same hurts that you have in life. And I got through it. So if I could get through it, you could get through it. So I think when we have those personal conversations with people, saying, look, I've been there. I know, and it helps a person. That's how I reach people, I reach more people by telling them. And a lot of times on my job, I'm called a peer support specialist. And what that means is that I have lived experiences and I got through them. So a lot of times on the call, they don't want to talk to KC because KC is a therapist.
Right.
You understand what I'm saying? They'll say
Absolutely.
it's all about being transparent.
But see,
And they don't want to talk to KC, and it's not that KC hasn't been through it, but it's my job when I get on the phone to say, hey, I'm here to help you get to the next level. And guess what? I was just like you.
But see, listen, this is really good, you guys. And what you're saying, Theo, is that it's almost like I'm in labor and I don't need to talk to somebody that haven't been in labor before. I want to show me the baby. I want to know somebody that went through the same hurt, pain, whatever it might be that I've gone through. And that's why you cannot, I mean, you are key. You're a key element to helping people because they want to talk to someone. The KC, they're going to respect her. She's got the books, but we already know, education is one thing. Come on now, but there's a lot of educated fools out here too. Let's get real. So the thing is that it's the truth. So, they used to say PhD is power higher and deeper, but we'll leave that alone for the moment. But my point is we give that respect, but at the end of the day, there's much respect to you because your authenticity of saying, hey, I've been there before. I've dealt with this. I know what you're going through. Listen, and you ain't gonna run no game on me because I done ran the same game. You tried to run on somebody else, Well, then they're gonna be like, oh, shoot, I can't run no game on her. She can ready to set some boundaries. And either I'm gonna come clean and I'm gonna move forward, or I'm gonna let her know I'm not. And she probably gonna leave me alone, which I think that's what you probably do, Theo. But anyway, I'm saying, because if somebody, they gotta want help. And the first step in helping is to say, I need help. And stepping through that door or whatever it may be. So that authenticity is key.
And it is huge. And I cannot tell you, like, Theo's speaking the truth, because we've had people that, like, I know, and Theo and I bring different energy too. So, I mean,
oh yeah, you guys got a good
gel
balance.
really well together. Yeah, but it's a great balance. So like, there are people that like are just like, I need to talk to Theo. I want to talk to Theo twice a week. You like, and I'll be like, and I'll just be in the background. I'm like, cool. But like watching,
don't talk to her, right?
But watching those interactions, I'm just like, and you can see it. I'm like, Theo is exactly the person they need, and I love it. I love it.
I appreciate you, KC.
We need more people like both of you guys. I'll call you guys. See, I said it, and it was my spirit, and I hadn't even talked to you, KC, but Theo told me who you were and how you vibe with her and that. So I fed off of her to say you guys were the dynamic duo. You saw I put that out there. And so that's what you are. I mean, like Batman and Robin. I'm going away.
And with that being said, it takes a team,
Yes.
like what she's saying. Like I used to work, what she told you, I used to work on the ACT team. And what the ACT team was, and if you need help or you need to know someone in your city that needs help, there may be an ACT team in your city. And what the ACT team is, and because if working with individuals that live with mental health are not very trusting. So what the ACT team does is we bring the hospital into the home.
Ooh.
You'll have your psychiatrist. Is it psychiatrist, Casey?
Mm-hmm. Psychiatrist.
Psychiatrist, a nurse. The nurse goes into the home, and a lot of people, if they're on the injection, a nurse will administer the injection within the home there, because a lot of mental health patients don't like to take medicine, just like us. We don't like to take medicine,
right?
And that's where the downfall starts, when they don't take the medicine. If you could get them on a long-lasting injection, sometimes that injection might last for a month, sometimes it might last for 3 months. It's according to what injection they're on. So it's called the ACT team here. I'm not sure what it would be called in your state.
What does ACT stand for?
Assertive Community Treatment.
Thank you.
And so what that means is instead of them going to the community center to get their pills and stuff, the community center basically comes to them. They see them twice a week. Sometimes they just want once a week. And they'll see the doctor. The doctor will come into the home once a month. They'll check the patient out, see how they're doing. Sometimes they'll send them to lab to get lab work done. And the what that lab work is going to tell you if their liver is functioning okay with the medication. And it'll also tell them if they're taking their medication.
Wow.
According to the lab work. So if you know someone in your hometown and they need an ACT team, sign them up for it.
Wow.
And they help with like housing and resources and making sure they've got that they're on Social Security if they need that. So they will do they will help people get through all the work.
So the ACT team, actually you bring the team to the person instead of the person having to call and have people say, well, what kind of insurance do you have? Well, we only take private payer. And that's frustrating to them too.
And a lot of people are on the ACT, they will be on the ACT team for years. They don't even want to go anywhere else because they've developed that relationship with those 5 people that they'll see, or
Wow.
whatever number they'll see.
Plus, you've got that
Wow.
team, and they all know what's going on, and they can pick up where the other person's left off. So,
Is that something that's just happening in New Orleans, or is that from state to state, or how does that work?
I think
Dr.
every
Pat,
state
can you
has
hear me?
them.
I'm trying to Google it for you now.
Okay.
Okay, I wanted to ask a question.
Okay.
Okay, can you hear me? This
Who
is
are
Sheila.
you?
Sheila?
Hi, Sheila. How are you?
I'm doing great, doing great. I've been enjoying this has been awesome. I have a brother that has been diagnosed schizophrenic, and he's now living in Ohio with my sister. Now do that also, he's with VA. How would that be because I think that's excellent that the doctors would sometime come to the home instead of and I
So
know he
you're
has to go in for his lab.
you're saying if he get VA services, could he get that?
Yes.
Most of the ACT teams, you have to be on Medicaid
Oh, okay.
because that's how they bill.
Okay, so he's on Medicare. He's like in
But
his
you
70s.
might check with that too, though, because I would check, and I would talk to the social worker. There's going to be a case manager or social worker at the VA too, and I would ask them.
And there is something called Ohio Guidestone. It's an assertive community treatment there.
Okay.
Remember, I was talking earlier about that Medicare, and I'm trying to help a relative now. And I've gone from state to state to state, and they need actually somewhere they can be for 28 days. They don't need to go to one of those 7-day deals. It's not going to work. But Medicare does not pay for it. So everywhere you call, these facilities want private pay. And he's on disability, Social Security, like what you're saying, Sheila. And it's a problem here. And this is where we start diving into our health care and what we have and why we have so many people out here with problems, because when they do want help, they can't find help.
I checked too.
No, and he's on medication that is experimental drugs. So he has to go in monthly for blood work. But what's so good, the drugs have been working for him. Oh my God, it's
awesome.
I mean, he's a chemist, by career. And we couldn't even hold a conversation. And with this drug that they have him on, he's able to hold conversations, for long periods of time. He's a different person.
Wow.
That's amazing.
Yeah. But this has been something ongoing for him for like about maybe 30 or 40 years now. He was he was a med student at the time, and he was passing out meds, and his mind, he was in the military and just lost it and never came back.
Wow.
That's scary too, especially that's such a big change to see that shift. So it's exciting that you're starting to be able to have those conversations with him again.
Great. I mean, you couldn't have a conversation with him. So what she's saying, I think is powerful, just the teams that they're making available now to come in the homes.
We definitely take note of that. I think that is powerful because people are on here listening, and I appreciate everybody on here. I want you guys to subscribe to Dr. B Stress Free, my YouTube station, because I'm telling you, it's going to get better and better. Dr. Janice Adams, I know you had your hand up.
Oh, can I say something to Miss Sheila first? Miss Sheila, I put the number in the place that might be an ACT team in Ohio for you. It's in the chat.
And check too, while you're saying that, check because Louisiana, we can have what's called a dual eligible. So you can have Medicare, and what Medicare doesn't pick up in Louisiana, that's behavioral health. So check to see if if anyone might be dual eligible. So if Medicare's not picking something up like that 28-day treatment, see if you can get on Medicaid as well, and then that might cover it.
Well, the individual actually has, in my situation, he pays for insurance. He's got United Healthcare because he has a son. But because of his situations, he's on disability, but he hasn't retired yet. He's an engineer. So at the end of the day, he has 2 insurances, but they're telling him he has to make Medicare his primary, which is messing him up from being able to get the help that he needs.
It's so frustrating. Yeah. That's why we have to, I agree. I think we need a change in the insurance, but that might be a bigger discussion
Yeah, I
than
mean,
where
that's
we are.
another
We
whole
need a
thing.
change in our politicians.
Oh God, here we go back to the politics. We'll talk about that on the next show. But Dr. Adams, you had a question, comment?
Yes, I just wanted to, I didn't want this time to escape us with KC and Theo in New Orleans or in your area. Are you familiar with the Adverse Childhood Experience at ACEs? It's called. And I noticed there were a couple of comments about the children and a big part of, who was it, Barbara, stating, what can we do kind of thing. Well, I work with a community where we're changing the language rather than say to the child, what happened, what's wrong with you, changing that language to what happened to you. And the research and the studies is showing that there are like 12 ACEs, and we all have some form of one of those ACEs, which are some of those triggers that affect those individuals that you guys you've been talking about, and the reasons we go to. So anyway, childhood experiences is a biggie.
And I'm glad you said that, because I was thinking I wanted to bring it back to that. It's, a big piece of it is changing that language, because I know that it's easy to be like, what's wrong with you? And even when we ask somebody how they're feeling, I also I tend to be strengths-based in my therapy practice. And so it's often I find myself asking, what do you need? Because we don't get asked that enough. And we don't necessarily even think about what we need. So that's, I think, another piece to start asking, what do you need? How can I help? Or where are you right? Like, where's your brain right now? And one of the ways too that we can help is and this is part of the reason I like play therapy, and I do expressive arts therapy a lot, because it gives a way to express what's going on internally, but you get to separate it from yourself as opposed to making it all stay inside. So that can be another piece of it too, is just making sure that kids are feeling heard, but also that they're not taking it's that message too that kids internalize that they're bad because something, maybe because of one of those ACEs, maybe one of those adverse childhood events happened, and they internalize that it's their fault, or that they did something that we don't like, and then they internalize that one action therefore defines their entire being. So also making sure that kids understand that they aren't bad, because I do believe that people are inherently good. We just have to find those strengths. Like, where do you get to that point of feeling that they can feel safe, that they can be who they are, and creating that safe, accepting space and that sense of belonging.
Wow.
So thank you for bringing that back up.
Wow. Well, ladies, my goodness. I mean, this thing's just getting better and better. And that is the whole purpose of this podcast, is just to bring on the experts, bring on the community, and just be able to answer questions, because we're not getting this. If you turn on the TV, you're seeing all this crazy stuff going on all the time. It's nothing helping anybody get any better. Nobody's trying to solve any problems anymore. I mean, either you're part of the problem, you're part of the solution. And I don't see the two coming together. I just see a lot of finger pointing, and who cares who did what, when, where. And some of the stuff we don't care about. What we want is, we're looking at our finances. That's the wealth part, the health, and you don't have any wealth without health, right? So number one, we have to take care of ourselves before we can even take care of anyone else. And mentally, it's so many people have checked out. The pandemic has done a job on us. And I was reading too, where a lot of kids aren't even going back to school since the pandemic. And a lot of people, if you think about, the customer service is horrible no matter where you go since the pandemic. A lot of people are using Zoom or whatever to take care of business, or, the human touch we've lost the human touch. And we have to bring that back. We have to bring that back in our communities. back in our churches. And yes, we have to bring church back. You know what I mean? We've got to bring people, there has to be a higher sense of purpose of where we're going and, you know, and what it's all about. So the purpose is for us to educate, because once you educate people, then you can motivate them to do better. You know what I mean? Educate, motivate, and then elevate our community. So I want to thank you, ladies. Oh my gosh, the dynamic duo. You just made it happen. And that's why I was telling Theo, I said, hey, I don't want nobody to get nervous about speaking. Just be who you are. Because so many, we're always trying to put on this facade. And, you know, I mean, I wore suits for so many years. I got my little t-shirt on. Just be who you are. You know what I mean? Because people will relate to you and they feel your energy. And oh my gosh, you guys have just delivered today. So I want to thank you. I know it's 8:20, so normally we don't even go. We try to stay within our hour time frame, but this has been so good. Are there any other closing remarks before I let these beautiful young ladies go?
I just want to thank everybody for being present. I want to thank KC for agreeing to do it as of yesterday. And I want to thank AB, whoever AB is, Miss Barbara, Sierra. She's my other coworker. She's a nurse that works for Humana with me. I want to thank Pastor Darlene Franklin. She's from Detroit, but she now resides in Dallas. I want to thank Janice, Kamara, Miss Lucy, my daughter Maya Renee, Sheila, and my partner, the good doctor.
The good doctor, do you have something you want to say to good doctor? We go way back. We worked for the Department of Army together. Good doctor, can you speak, or do we gonna just let this fly?
I think she's working on that truck that came in for the people at Slidell that lost stuff. So she might have a hands full.
That's okay. That's okay. She's in the community making some things happen.
And don't forget, if you want the best candle in the world, soyforserenity.com. And I'm also going to be coming out with my sprays. I'm working on it.
Okay, so now
that's not pro marketing.
So Theo, so I put it in the chat. So they go to place an order. What does someone have to do?
Soyforserenity.com, just like you're going to Walmart.com, press the button, check out, pay, wait for your candles.
Okie dokie. All right, you guys heard it from the best. I want to thank you guys.
Oh, and they have a burn time of, and Sierra is on here too. They have a burn time of like over 30 hours. And I've been, yeah, but you have to make sure you trim your wicks. Whether it's my candle or any candle, your candle life is long, it's kept long by the shortness of the wick. When that wick starts getting black, it's time to cut it down. Whether it's mine or any candle, to keep the longevity of your life or your candle.
Wow, more education.
And with that, I'll give you the benediction.
Okay. All right. Wow. Well, you guys are just, like I said, you guys have been phenomenal. I want to thank you. And I just want to ask everybody, if everybody keeps joining us on Tuesdays at 7 o'clock Eastern Standard Time, 6 o'clock Central Standard Time. And I'm always open for people that want to speak and topics and that. We'll put you on and let's do this and let's make some things happen. And I'm definitely in entrepreneurship. I don't think we do enough of it, help and support each other and network. So order your candle today.
And I was also telling you about my coworker, Sierra. She also works in substance abuse and she's a nurse. So she might be a great person to network with you.
Hi, Sierra. Did you want to say anything?
Absolutely.
Sierra, okay, well, we'll get Sierra on the next episode. How about that? If she's
for sure.
Okay.
Y'all have a great evening.
You guys have a blessed evening. Again, don't forget to go
thank you all.
And subscribe and get your candle today. Love you all.
Good night.
Bye.
Good night.
Good
Be
night.
safe.
Good night.
Good night. Thanks everybody for joining us.